Boy, we all know that technology has been changing the world and technology has impact in epilepsy. We have a special guest with us now from NYU Langone, Dr. Dan Friedman, that's going to homeschool us on what technology can do for us and those that we love with epilepsy.
Hi, good day. My name is Dan Friedman. I'm a neurologist at the NYU Comprehensive Epilepsy Center. And I want to thank the organizers for inviting me to speak today about epilepsy technology and wearable devices. Today I'm going to talk a little bit about the role of wearable devices in epilepsy care, as well as discuss some emerging new technologies that may impact on how we treat people with epilepsy in the future. What are the potential roles for wearables? Wearable devices can be used for two main things. They can be used to count seizures in people with epilepsy, and perhaps their most familiar role is for use to alert caregivers that a seizure is happening and help them provide aid to reduce the risk of, from the seizure, including the risks of injury, the risks of prolonged seizures, and the risks of sudden death from SUDEP. I'll quickly go over the rationale for why wearables may be also important for counting seizures, and which means that patients and caregivers report their seizures, and the clinicians, based on that report, determine if a treatment is working, if changes need to be made, if certain restrictions, such as driving restrictions, can be lifted. And these reports are provided to the office at each visit, perhaps if we're lucky, if the person remembers to bring their diary. But most of the disease occurs outside of office visits. So the current state of the art is essentially this: a calendar, whether it's a paper calendar or a digital calendar, where the patient or their family member records when seizures happen. But we know that patients are actually pretty good at reporting when they're having seizures. Several studies done in the hospital have shown that patients are often unaware of some or all of their seizures because the seizures themselves impair awareness or memory. This unawareness is probably most significant for focal unaware seizures, or what we used to call complex partial seizures, but even convulsions. Tonic-clonic seizures can be unrecognized by patients. Patients know they're pretty bad at reporting seizures too. Surveys of patients with epilepsy suggest they know that a majority of their seizures are not noticed by them. And even among those who actually keep seizure diaries, they're aware of the poor reliability of this diary and that it doesn't really often reflect the reality of their epilepsy. Studies have also shown that caregivers, parents, and other family members are often unreliable reporters too. Studies done in pediatric epilepsy monitoring units suggest that parents can miss half of their child's seizures, mostly the subtle ones like absences, but even very brief motor seizures like tonic seizures can be missed if nobody's looking. We also need to be able to detect seizures for seizure safety. Studies have shown that supervision at night, either in person or the use of a monitor, can reduce the risk of sudden death from epilepsy, from SUDEP. And people that don't share a room or are not monitored and have uncontrolled tonic-clonic seizures are actually at the highest risk for SUDEP. We think that timely aid, such as repositioning or stimulation or other basic first aid measures, can help reverse the impact of the seizure on breathing and cardiac problems. that could get people into trouble. And we also know that in patients who are prone to prolonged seizures, such as status epilepticus or clusters of seizures, early use of rescue treatments such as diazepam or midazolam can be more successful in stopping the seizure compared to delayed treatments later in the course of the seizure. So how can technology help us provide it with more reliable tools for seizure counting and alerting? There are multiple ways that sensors can be used to detect seizure activity. So seizures can be detected based on changes in brain activity, body movement, such as the typical shaking associated with a generalized tonic-clonic seizure, muscle contraction through the detection of the stiffening, sometimes seen with tonic and tonic-clonic seizures, seizure-related breathing abnormalities, such as changes in blood oxygenation, can be detected with sensors, as can seizure-related changes in heart rate or sweating. And finally, seizures can have an associated characteristic sound, an audio that can be detected with audio sensors, like the groan associated with a tonic-clonic seizure, or other stereotype sounds that some patients make with their seizures. Perhaps the most reliable way to detect seizure activity is through the measurement of brain activity. And we've been doing this since the 1930s, where EEGs can apply to the entire surface of the head, have been used for counting seizures and detecting when seizures occur in patients in the hospital or patients undergoing brief home monitoring. Obviously, this is not practical for long-term home use. It's costly, it's inconvenient, and really can only be done for a few days at a time to answer very specific clinical questions, like where the seizure is coming from, or if the event that person is having frequently is really a seizure. But recently, there's been an interest in using small sensors applied not to the whole head, but to portions of the head where we think may reflect, maybe over the part of brain where we think the seizure is coming from, to detect seizures. And these sensors can be patches that are applied to the scalp, sensors that can be put in the ear to detect kind of like hearing aids, or even sensors that can be placed under the skin but above the skull, all that can detect brain activity coming from a small region of the brain. These types of devices are obviously much cheaper than scalp EEG, much more convenient, and they are able to record brain activity over weeks or months. The problems may be that you need to know where the seizures come from to optimally place these devices. These devices are really at the start of their sort of investigation, and we don't know how well they'll perform. Obviously, people still need to put on and take off, charge these devices. And we need specialized algorithms to be able to interpret these signals and identify when seizures are coming. Really, right now, the bulk of the devices that are available and have been focused on measuring activity outside of the brain or non-brain related activity. And wearable seizure detection devices use that are available commercially can use muscle activity and audio, like this device, which sits over the bicep. They can use accelerometry, which are special sensors to detect rhythmic movements, and skin conductance, like this device, the Empatica Embrace device. Special apps that run on regular consumer smartwatches have been developed, often leveraging the fact that a lot of these watches have sensors built into them that they use for fitness tracking that can be used for seizure tracking as well, like accelerometry and audio. And here's another example of a device using accelerometry. Studies show that these types of devices, when looking at tonic-clonic seizures, can detect between 80 and 100% of these severe seizure types, but they have a false alarm rate of about 0.1 to 0.9 per day when tested in the hospital setting. In the real world setting, where people are doing exercise, chopping vegetables, playing video games, that false alarm rate can be higher. When patients have infrequent seizures, the likelihood that any given alarm represents a real seizure is actually pretty low. And it raises the possibility that patients and families may be eventually overcome by alarm fatigue. There's also an interest in developing technology for seizure detection that isn't wearable, that doesn't require you putting on a sensor. And this uses various methods like video or mattress-based seizure detection, or even audio sensors to detect seizures. But they're all limited to a very specific location. These types of sensors are usually fixed, and they're typically used for monitoring for nighttime seizures in the bedroom. Video-based seizure detection is used to detect nighttime seizures in the bed, usually using computer algorithms to detect motion in the video stream. And so therefore, these devices are useful for seizures with a pretty significant movement component. None of these devices that are on the market are currently FDA approved for seizure detection, although this device from Neurovent Labs recently got FDA approval for seizure diagnosis in the home. Mattress-based sensors use speakers or sensors to detect seizure-related bed movements, again at night for tonic-clonic seizures. Some of them perform pretty well, but they require a lot of individualized tuning, and they actually don't work as well in lighter children. None of these devices are currently FDA approved for seizure detection and alerting. And perhaps one of the oldest methods for seizure detection is the use of audio. Seizures are often associated with very characteristic sounds like cries or groans. And some studies have shown that these sounds can actually be used to accurately detect seizures and alert caregivers that a loved one is having a seizure in another room. Some caregivers have used physiological monitors like the type that we employ in hospitals, such as pulse oximeters, which can detect low blood oxygen levels or heart rate changes, or other heart rate monitors to set alarms because the changes in some of these measures have been associated with seizures especially tonic-clonic seizures. And they may help alert family members when a especially dangerous seizure is changing place. This type of approach hasn't been really well validated outside of the hospital, but there are devices that are in development that use some of these features to help families detect when their loved one is having a seizure. And no discussion of seizure detection would be complete without the discussion of seizure detection dogs, which may help alert family members when somebody in the home is having a seizure by barking or getting help. We don't know how well seizure detection dogs work, and how often they miss seizures. So one of the questions that I get asked quite often by patients is there a currently available seizure alerting method that's right for me or my family member? And the two questions that I ask is, do the seizures have a prominent motor component that's rhythmic, or there are other pretty significant movements? Are the seizures have characteristic sounds? And then as well as, where do you want to do your monitoring? Are you just worried about nighttime seizures in the bedroom? Or would you like to monitor both inside and outside the home? And this chart sort of highlights some basic thoughts about which devices work best in which situations. So if a person has convulsive seizures, then wrist wearable devices that detect motion may be used, muscle activity sensors, video devices in the bedroom, mattress sensors, audio sensors can detect some types of convulsive seizures, and perhaps even vital sign monitors can detect them. If patients have non-convulsive seizures or seizures with very brief movements, most of the devices that rely on movement will fail to detect and alert for these types of seizures. Obviously, some devices work better, work only in the home, such as video devices or mattress devices, or muscle activity sensors, which are work best for sleep-related seizures. Some devices may be tied to smartphones and then can alert caregivers at distant locations that a seizure is taking place. And some only have local alarms. Each type of device has its own caveats. Wrist wearables may be prone to false alarms, especially when people are awake. The devices need to be put on correctly and charged to work properly. Because the sensors are always active, the current generation of devices require pretty frequent charging. Muscle activity sensors are really only useful at night, and even then they have to be positioned correctly to be able to reliably pick up the electrical activity of the muscle. Video devices need to be able to see a patient, so blankets and stuffed animals may interfere with the performance of these devices. And as I said, mattress sensors are limited to the bed and may not be reliable for younger and lighter children. Other things that are important to note is that no device has been proven to prevent SUDEP or other complications of seizures. There's only 2 devices that are FDA approved for seizure detection, and only one, the Empatica Embrace 2 device, which is currently on the market. Insurance coverage is hard to obtain for these devices, though healthcare savings account may reimburse for them. And this is a very rapidly evolving field, so I recommend everybody check in at epilepsy.com for the latest news on devices. In the next few minutes, I just want to talk about other technologies that are available or on the horizon for epilepsy management. And I want to highlight electronic seizure diaries. So in the beginning of my talk, I showed the calendar that my patient brought in, and that's sort of how we viewed seizure tracking in the past. Patients would complete a calendar either on paper or electronically, and when they came to their doctor's visit, they would bring that calendar with them and review the seizures. But the availability of internet-connected devices and apps and other devices has opened up the door for a more robust electronic seizure diaries. Diaries that can run on your smartphone or even your Alexa or other home speaker. They can track seizures and side effects, help identify triggers. They could provide insights back to the patient or caregiver about the disease and associations with other behaviors like sleep or stress or diet, by integrating with other sensors in the smartphone or things like fitness trackers. Some of these electronic diaries allow sharing the data with clinicians, integration of the data into the medical records. And there's emerging research that just by tracking seizures for some patients, you can identify when patients will be at increased seizure risk in the future, using sophisticated machine learning, artificial intelligence algorithms. And this kind of forecasting is really one of the bright futures of technology in epilepsy. One of the greatest burdens of epilepsy is the unpredictability of seizures. People don't know when a seizure is coming and are unable to prepare for it. And that causes both injury and distress. Over a decade ago, studies showed that for some patients, implanted devices into the brain were able to decode brain signals and identify low and high risk seizure states and be able to show patients what their risk state was for the coming time period, kind of like weather forecasting. And there's ongoing research right now through multinational, multi-center initiatives like the My Seizure Gauge Challenge to determine if this type of forecasting may be done through simple seizure diaries or even wearable devices. And the goal of this type of research is to be able to provide patients with essentially a weather forecast of their seizure risk. So they know, just like a weather app will tell them what if they should bring an umbrella because it's highly likely to rain, that they may need to change their activity because they're at high risk for a seizure. This type of information may help people do things like take extra medicine when they're at a high risk state, or take certain precautions when they're in a high-risk state, or more importantly, feel comfortable doing certain activities when they're in a low-risk state. There's no discussion of technologies and devices for epilepsy would be complete without sort of talking about some of the things that we also need to address at the same time, including cost, insurance coverage, regulation, who oversees when devices and technologies can be marketed to patients. Stigma. People don't want wearables or other devices that call attention to their epilepsy, and are very much interested in devices that sort of seamlessly blend in, or even better, apps that work on consumer electronic devices like smartwatches, which don't call attention to their epilepsy at all. There's interest in with integration with other streams of data like electronic health records, prescription information, lab results, and perhaps other consumer devices like fitness trackers. An important factor is who owns the data, and how portable is it between platforms. So for instance, if I'm using a electronic seizure diary, and the next week I want to try a different electronic seizure diary, what happens to all the data that I collected using the prior platform? With any personal data, there's always concerns about privacy and the use of that data. Should it fall into other people's hands for discrimination in employment or insurance? And also expectations for who is monitoring this data and how often and when. So with that, I thank you for your attention, and I hope you enjoy the rest of this day's topics.